Hi, I'm Dr. Dooley, a board certified psychiatrist practicing in Georgia, and I'm here to talk briefly about depression. Most of us have experienced feeling sad, lonely, or frustrated from time to time, but the symptoms don't persist and they don't significantly impact our ability to live our daily life. Clinical depression, also known as major depressive disorder, is different. It is a depressed mood that persists and it negatively impacts a person's ability to work, play, and interact with others. Sometimes depressed people have a condition called anhedonia, and that is when a person has lack of interest or pleasure in things they used to enjoy. Other symptoms of depression include problems with sleep, energy, appetite, and concentration. People who have depression may feel excessively guilty about things, and they also may be physically restless or agitated, or the opposite. They can talk and move slowly. And when depression progresses and becomes severe, an individual may develop thoughts of ending their life, which are called suicidal ideations. The good news is we have effective treatments for depression. One of the primary treatments for depression is talk therapy. Talk therapy can help people process difficult emotions from the past or present, and it can also help people gain new skills to manage stress or their mood. Medication can also be a useful tool for managing depression. Medications for depression can be prescribed by a primary care specialist or a psychiatric nurse practitioner or psychiatrist. One of the most important things to know when it comes to taking medications for depression is that they may take several weeks before the effectiveness is known and the dose may have to be increased. So it's vitally important that you take the medication every day as prescribed, even if you don't notice much change right away. Another important tip is to let your provider know what medications you're taking over the counter, including herbal medications. This will decrease the likelihood of a drug interaction. Most people are able to take medications for depression without any significant side effects. However, it's important to alert your healthcare provider if you develop side effects or have any other questions or concerns about your medication. And lastly, exercise can aid in prevention and with treating mild to moderate depressive symptoms. So physical activity is helpful for the mind and body. So remember, it's normal to have sad days from time to time. But if you are having a persistent depressive mood that is negatively interfering with your ability to work, be in school, or interact with others, please seek a healthcare evaluation. If you're having a mental health crisis, please contact the National Suicide Prevention Lifeline. That number is 1-800-273-8255. If you're a veteran, you can press 1 to reach the Veterans Crisis Line. Remember, you're not alone, help is available, and you can get better.